and I think he's going to help us get across the finish line with the leverage that we have from tariffs.
They're smart. Don't let them get away with it, Howard.
Well, the combination of Bobby's MFN and the 232 Pharmaceuticals, which we launched together,
Right.
when you put those two together, it really gives Bobby the tools to go execute your plan. So I'm supporting Bobby as he executes his plan.
Good. Brett?
Yes, and this cabinet meeting is supposed to be about working Americans and bringing jobs back to this country, and particularly rural America. And I want to mention the big, beautiful bill. Right now, we spend 7% of Medicaid dollars on rural hospitals. So they're getting the short end of the stick. It's about $19 billion a year. Under the Rural Transformation Program, we give them an extra $10 billion a year. So we're raising an infusion of cash to rural hospitals and rural communities by 50%. It's going to be the biggest infusion in history, and it's going to restore and revitalize these communities. And we can't survive as a nation if we don't honor our rural communities, which are the source of our values, our virtues, our character, our economy, our food. And you are bringing that back. You are bringing those communities back. I wanted to talk, because you mentioned the wind farms, we now have an interdepartmental coalition, a team, which is Doug Burgum and Howard Lutnick and Chris Wright and Pete Hegseth. We're all working on this issue. And Lee. Sorry, Lee. We're all working together on this issue. We're meeting together. There are right now 11 wind farms planned that were launched during the Biden administration. Between Maine and Virginia, it's 1,130 towers. These towers are twice the size of the Washington Monument. The blades on them
They're massive. It's so crazy.
The blades are 350 feet long, one blade. One of these blades blew up on Nantucket last summer, and the water was filled with shards of glass, of sharp glass, so it's dangerous to swim. They had to close the beaches, but they have indemnified themselves so the local communities can't sue them. None of these projects are bonded. If you build an oil derrick in the Gulf, you got to put a bond down. There's no bond for dismantling them, and that's one of the tools that Doug is now using to challenge some of these projects. None of the cost of energy from these projects is 39 cents a kilowatt hour. The average cost in this country is 17 cents per kilowatt hour.
And natural gas is 3 cents.
Right. So it is the most expensive energy. I've been representing commercial fishermen for 40 years. They are so excited about what you're doing, Mr. President, because their fisheries are being wiped out. As soon as they begin construction, the groundfish fisheries just disappear. The fish leave the area. They've killed 160 whales in the last 2 years. So they're wiping out the whale population, the Atlantic whale population, the big whales, the minkies, the gray whale, or the humpback whales, the right whales. And you are going to save the whales on the East Coast because of this. And you're going to save these economies that are based upon commercial fishing. I'll say one other thing about fishing. We are now, the South Asian nations are now dumping shrimp on our country. The shrimp is heavily contaminated. We just stopped a shipment that was contaminated with cesium-157, which is radioactive. They're farming these shrimps, and they use bactericides and antibiotics and all kinds of chemicals, and the shrimp are so contaminated that the European nations won't take them, so they're dumping them all here, and they're putting out of business. We have the most sustainable, highly regulated fishery in the world. What our fishermen do is a good thing. And all of the trawlers in the Gulf and Alaska are being shut down because we're getting shrimp dumped here. So we have now increased FDA inspections of shrimp to make sure that Americans are not buying and eating contaminated shrimp and putting our shrimpers out of business. I talked just very briefly, we have an historic agreement on pre-authorization. We brought together 80% of the insurance industry, which has agreed to, for 80% of diseases and injuries, give immediate pre-authorization so that when you go to your doctor's office and he prescribes you a new knee or whatever it is, you will immediately know whether your insurance company is going to pay for it. This is an historic agreement. People have been trying to do it for decades, and we, because of your leadership, brought the insurance industry together and got them to voluntarily agree to do this. Similarly, we made another historic agreement with personal health records. The 60 biggest tech companies in our country have all agreed to allow Americans for the first time access to their personal data, which they own, which these companies have been monetizing without permission. You're going to be able to see by next year all of your health records on your cell phone. It's going to save lives. It is going to fuel an infusion of technology into that space where people can access those records. They can compare their diet to what they personally need, and we'll have personalized medicine. We are doing price transparency. You passed this during your first term, and then the Biden administration refused to enforce it. We've now brought at HHS, under your leadership and my leadership, more enforcement actions than during the entire 4 years of the Biden administration.
Right.
So we're going to have that kind of price transparency. I'm working with Linda on forcing medical schools and the MCATs, the people who administer the MCATs, the people who do accreditations, to put nutrition into medical school education. Right now, 25% of the doctors in this country do not feel competent to give nutritional advice. 70% of diabetes cases can be reversed or ended if you just change people's diets, and the doctors don't know how to advise it. They only know how to prescribe the drugs. We're going to change that, so if you come out of a medical school under the Trump administration, you are going to know about diet. And then finally, most importantly, the Pete and Bobby Challenge. I want to give an update. Pete got, or I got 5 minutes and 48. It's 100 push-ups, 50 pull-ups, and you try to do it within 10 minutes. I got 5 minutes and 48 seconds. Pete beat me. I'm still bitter at that. 5 minutes and 25. The cabinet leader is Scott Turner.
You beat me.
Dislocated arm.
That's
You
good.
got 5 minutes and 15 seconds. I'm waiting for reports from the rest of the cabinet. The only exemptions currently existing is if you can hit a 50 at Bedminster, which President Trump did with Bryce and DeChambeau, so he's the only one exempt in this room. Everybody else.
That's great, Bobby. Bobby, autism, if I could just, I don't want to go too long because we have a lot of people, but the autism is such a tremendous horror show, what's happening in our country and some other countries, but mostly our country. How are you doing on that?
We are doing very well. We will have announcements as promised in September. We're finding certain interventions now that are clearly, almost certainly causing autism. And we're going to be able to address those in September.
It's such a big day. I'm looking forward to that day because there's something wrong when you see the kind of numbers that you have today versus 20 years ago. And those numbers, what are those numbers, Bob?
Well, in 1970, the biggest epidemiological study in history was done in Wisconsin. They looked at 900,000 children, and they were looking for autism. They knew what it looked like, and they were very, very precise about it, and they found an incident rate of 0.7, in other words, less than 1 per every 10,000 children. Today, our most recent numbers are 1 in every 31 kids. It's probably actually much worse than that because California, which has the best collection system, is reporting 1 out of every 19 children, American children, has autism, 1 in every 12.5 boys. So it's gone from less than 1 in 10,000 in 1970 to 1 in 12.5 boys
Think
today.
of those numbers. So there has to be something artificially causing this, meaning a drug or something. And I know you're looking very strongly at different things, and I hope you can come out with that as soon as possible.
We will.
So 1 in 10,000, and now it's 1 in 31 or 34 or 12 if it's a boy. Can you imagine that? 1 in 12. That's for a boy.
1 out of every 12.5 boys.
It's not even believable that that could be. And that was 1 in 10,000 not so long ago. I've been hearing these numbers that, and they get worse and worse every year. There's got to be something. I think there's nothing, including favored nations and everything else, there's nothing that can be, if you can find out the reason that that's happening, and I know we're gonna do some things. I think it's,
We
I
will
think,
have that answer
I think
for
we,
you.
I think we maybe know the reason, and I look forward to that press conference, to be with you on that press conference. That's going to be a great thing. Thank you, Bob. You're doing
Thank
a
you,
great
Mr.
job.
President.
Linda, how about it? And we want nothing less than $500 million from Harvard. Don't negotiate, Linda. They've been very bad. Don't negotiate. Go ahead.
All that's working. Well, Mr. President, thank you very much. Since we are focusing today on Labor Day, and I know that Kelly and Lori are both going to echo some of the things that I'll say as well. We are really focusing, on our workforce. But what I'm finding with great joy around the country is that states really are being innovative and working more with middle schools and with high schools to make sure that we are having hands-on learning. There are pathways to jobs that are happening now. And if we see more and more of our community colleges working with our middle schools and our high schools so that high school students are graduating not only with a diploma, but a certificate that they have worked with, perhaps with a Toyota or another company that is coming in, public-private partnerships. And they're learning on the job so that when they graduate from high school,